This morning's substance use disorder intake screening and assessment work group meeting. As usual, I just want to cover a couple things. Just a disclaimer that this meeting is being recorded and will be posted to the HCA website on a webpage dedicated to the SUDISA Work Group. So please begin recording. It's been recording now. This recording is open to public disclosure. So please do not disclose any private or confidential information. If there's anyone here from the public who is not a member of the work group, please know that this work group is not subject to the Open Public Meetings Act. However, members of the public are welcome to attend and observe the SUD Intake Screening and Assessment work group meetings. Meeting participation, including use of the chat, will be limited to work group members unless otherwise specified. For example, if there is a guest participant, a panelist, presenter, etc. So if you are not a work group member, committee member, and would like to provide comment or questions for the work group's consideration, please send an email to hcaesb5476@hca.wa.gov, and the work group administrator will share your message with the work group. All right. And now I'll go ahead and review the agenda so we're all on the same page about what's coming up for us today. So we're not, for the sake of time, we're gonna skip over the roll call actually. But there are a couple announcements or updates I wanted to provide as part of the welcome section. So there was a recommendation that had been brought up, and we had dedicated a breakout room to it originally, actually, around this idea to encourage communities to submit certificates of need to establish new facilities for behavioral health services in their areas. And this is a great idea in terms of requesting for funding or pursuing grants or other opportunities to get facilities built. However, as I looked into this, I realized that a certificate of need is not an application or a request for funding to build a new facility or service. It is something that is simply required from an area before they can build something like that. So rather than being something that provides an opportunity for or funding for something to be built, it's actually like if an area, there are certain services that require a community to submit and receive a certificate of need. Like you must prove that you need this service in your area before you can build it. And so correct me if I'm wrong, but I don't think that knowing that information, that certificate of need is something that we actually want to pursue as a recommendation for behavioral health services. So because of that, we've removed that as a breakout room focus for today. If there's time and we want to loop back to a recommendation around requesting funding for new services, we can, but I also think it's worth noting that that's a little bit out of the scope of what the assignment for the work group has been. It's a good idea, and I think there's a need for it, but it's not directly related to intake, screening, and assessment, and therefore I just am not sure how much time we should spend on that unless we have leftover time. So if there's any questions or comments, input about that, I'm just going to leave a few moments to receive any questions. All right. And then Kelly usually goes over the SharePoint SUDISA page. I'm going to skip over that part today so we can maximize time in our breakout rooms. And so what we will do for these breakout rooms, we've got 4 recommendations that, we've got the seed of it figured out, like we know what we want to do. But now, in these breakout rooms, what we're going to do is go through a few different prompts that our technical report writer, Brianna Peterson, has provided to us to help us make the case for each of these recommendations. So these prompts will help us be able to articulate the need for the recommendation, the impact that we anticipate it will have, the problem that it solves, any kind of background information that will be important for the legislature to understand about it, as well as taking some other things into consideration as well. So this is where things get. I mean, this is hard. It's difficult work, right? And we may need to assign folks to look into things, do a little bit more research, get some answers to questions that are pending. We may realize that we may need to pivot some of the recommendations based on new information that comes to light. But this is where we get to really start drafting these out into very actionable recommendations for our state. So with all of that said, I will be checking in around 9:45 into the different breakout rooms, but you'll be meeting from about 9:15 to 10:25. If you finish drafting out the recommendation and all of those pieces before um, then let your steering committee member know, and they can send me a message on Teams, because I'm not sure how the chat works, if I can see that from the breakout rooms. And in any case, I can release you from the breakout rooms and bring you back to the main room early if you're ready. And otherwise, we'll just convene for some final thoughts around 10:25 and take a look at the next agenda. So I think I've talked enough. Are there any questions about the breakout rooms and how we're going to go about that? Oh, let's see. Okay. So I don't. Oh, sorry. There was someone. I heard a voice.
Yeah, this is Teresa. I'm a little, there wasn't a visual, like, is there like for the breakout room? So there's 4, and then is there like essentially a proposed agenda on how that time needs to be broken out?
There's not an agenda on how the time needs to be broken out, but thank you for um, mentioning this. So here, let me show you a visual that may help.
And then maybe roles, right? So do you want the steering committee person to be like the note taker, or like
Yes, good
how
call.
is it structured?
Yeah, good
Sorry,
call. No, this is great. This is good. Great questions. So for the breakout rooms, yes, we will need someone to be the note taker, and whoever is the note taker, I'll drop the link to the SharePoint document for the recommendation for that room in the chat, so the note taker can open that up right away and be ready to share that with the group in the breakout room and take notes for the group. So for room 1, and we'll just go room by room and make assignments right now so that everyone's clear on who's taking notes and who needs to have the document open. So for room 1, the recommendation is to increase reimbursement and wages for behavioral health care service providers. In that room right now, we have Teresa Claycamp from the steering committee, Beth Myers, Alicia Egan, and Charnay Ducrest. Who among those folks is willing to be the note taker? And I'm putting that document in the chat. So all the room 1 folks can make sure that they have access to that.
If folks need me, this is Teresa, if folks need me to be it, or Alicia, if you want to, that's fine. Somebody's got to do it.
I was just gonna volunteer because nobody else was. So whichever one works best.
Okay. Alicia, I'm going to give it to you. I hope that's all right. Can you verify that you can open the SharePoint document in the chat?
Yeah, just give me 1 second here. Yes, I have it open.
Okay, perfect. So let me actually walk through this this document also, so you can see kind of how the different prompts will be working. This one is built out a little more than the other ones already, but basically we'll have the recommendation, like one sentence up at the top, just to identify like which one is this. And then there's the summary. So this is where we'll explain the system, policy, or process change proposed, where we get specific about what needs to be changed. Describe actions involved and elaborate why the proposed recommendation is critical to meet the request from the legislature. Then there's a section for the background. So if there's like history, other context, including system, policy, procedure behind the issue or problem, that would be explained here. Then need, explain the problem or issue that providers or individuals are experiencing and how the proposed recommendation will solve the problem. Describe the anticipated results and objectives that this change expects to accomplish. And then the need assessment can go in, that need spot there. And it looks like Alicia and Charnay were working on that as well for this one. And then we've got the anticipated impact of the implementation of the recommendation. So if this recommendation is adopted, what do we expect will happen? And then the proposed recommendation. So this is where you can get a bit more specific if it needs elaborated on what exactly we are requesting or recommending the state to do. And then if there's any collaboration or existing programs that will also need to be either that will be impacted or that will need buy-in from, then that would go here. So list out current programs in the space and any legislature or grants that could work with this recommendation, including collaboration with other state agencies or requested waivers or requests to amend state or federal contracts. Financial impact. Does this recommendation pose any potential financial impacts to programs, grants, or state budgets? What are the recommendations to address any monetary adjustments to system, policy, and procedures? The one thing you don't need to worry about in the prompts right now is this SURSAC feedback part, because that will just happen when we have the recommendations more fully drafted and ready to present to the committee members. And then we'll get feedback from them. But you don't need to worry about that right now. That will just be added later on, probably sometime next month. So let's see. It's a little preview of the work that you'll be doing in each of the recommendations. So now I'll go back to that list of the breakout rooms. And in room 2, the recommendation you'll be working on is providing education to substance use treatment service providers to clarify the state requirements related to intake and assessment procedures needed prior to providing different types of services. And I just added a note that many of the requirements will shift with the implementation of the ASAM 4th edition criteria, which HCA will adopt by January 1st, 2026. So those will need to be taken into consideration within this recommendation too. And Kelly provided a little clip of Teresa's presentation from several meetings ago on the ASAM criteria and how it's changing. So if the work group wanted to spend a bit of your time watching that clip as a refresher, that might be a good use of time before diving in. Anyway, that's there if you need it. And we've got Eliza Tharp in this breakout room as a steering committee member, as well as Ruth Leonard, and then Dallas as a work group member. Are there any other work group members that want to be in room 2 working on this recommendation that have not already been assigned? Dominique, I don't think I heard back from you about which room. Do you not have a preference for which recommendation you work on?
Not really.
Okay. Do you mind if I add you to this one then?
Sure.
Okay. Okay. All right. And then do we have a volunteer for taking notes in room 2?
This is Ruth. I can do it if no one else is interested.
Okay. Thank you, Ruth. Great. And I'll drop the, whoops. Need to do that. And here's that SharePoint link in the chat now for room 2. And then room 3, we're working on expansion of services that can be provided prior to an SUD assessment. For example, peer case management. And in that room, we have Maida Hogan from the steering committee, Brandy Branch, Amy Rouge, and Angela Tonkovic. I'm trying to see who's here in the meeting and who hasn't been assigned to a room yet. So it looks like Lisa, I don't have you assigned. Are you? Yeah. Let's see. And then I don't know who's calling in on the phone, 503-290-4707.
That's Brandy. I just happen to have a backup.
Oh, okay.
Because my
Okay, great.
computer's kind of wonky right now.
Okay, yeah, that's smart. Okay. All right. So room 3, any volunteers for note taking?
I'm happy to take notes.
Okay, awesome. Thank you so much. All right. And there's the room 3 SharePoint document in the chat now. So Molly, you're the only one that volunteered to work in the room 4 recommendation. This is not a problem necessarily if you want to just, take a swing at it on your own. But if you prefer to join a different group, definitely want to open that option up to you. What's your preference?
I've done lots of virtual care. I don't have a problem staying in room 4.
Okay. All right. Sounds great. And we will, revisit all of these and try to give as many people opportunity to provide input on as many of these recommendations as possible. But I think we are going to get a lot of momentum working in the groups together during the meeting today. So this will be a great start for these. And I will go ahead and start breaking folks out into rooms. Yeah, Brianna, go ahead.
Did you want to let them know about me?
Well, sure. How about you let them know what you're, yeah.
So I don't think many of you got an opportunity to be in the original SURSAC, or maybe you did get to listen in. So as the report writer for this report and other various reports, I typically assist with the writing process. So I will be kind of popping in and kind of like observing, listening. I'm there if you guys have any questions regarding any of the questions or anything else. So I'll be popping into the rooms just to kind of like see what you guys are up to and provide any assistance along the way. Normally I'll be normally I'm the one writing all of them, but because we're trying to do this in a condensed schedule, we're doing it in these breakout rooms, and so I don't get an opportunity to write them all. So I'll be kind of just in the background assisting. So if you need me, I'll be popping in.
Thanks, Brianna. Yeah, sorry, I forgot to mention yours. We have our technical writer here with us today who is going to be popping into the different rooms and helping out. So thank you for that.
Yeah.
And it's going to take me.
Hey, Michelle.
Yeah.
This is Eliza. If needed, I can be in room 4 if we want to have a steering committee member so that they're all represented. And I can touch base on that.
Oh, great. Okay. Yeah, thank you. Let's see. Okay, so I think many of the SUDISA steering committee folks were assigned as co-organizers to this meeting so that you can kind of hop around the rooms, because I'm noticing that I can't assign you to a room. So, so Eliza, if you could just kind of self-assign to room 4, that would be great. And I think, Maida, you'll need to self-assign to your room also, and Teresa and Ruth. Actually, no, Teresa, for some reason, I can assign you to the room. So I'm going to go ahead and put you in room 1. Okay.
Michelle, this is Lisa, and I can participate in room 3.
Oh, great. Okay. Thank you, Lisa. Excellent. All right. Dallas, room 2. Let's see. And then Grace, did you want to be in any particular room to just like observe? Are you, I see you in the list of participants, but then I didn't know what room to add you into. Ellie's room 4, Beth Myers 1. Okay. So
I'm
there's still
here.
a couple of folks unassigned. Sorry?
I said I'm here now.
Oh, great. Okay.
I just got here. Sorry I was late. I had another patient that I had to attend to.
Oh, okay. I've got you in room 1. We're just about to break out into our rooms.
Okay.
So, yeah. Okay, great. So Rachel Downs and Grace Burkhart, I don't have you assigned to rooms, so I think you're just going to end up staying in the main room. Steering committee members who have not been assigned a room, you'll be able to go to the rooms icon at the top of your Teams screen, and I think just enter whichever room you need to go to. So here we go. All right, so all the all the work group members should be in their rooms. Our Are you able, Ruth, Eliza, Brianna, Sarah, are you all able to go to the rooms tab at the top and just kind of select a room to join?
I think I'm in a room, in room 2.
I'm for
in-
some
I'm in
reason,
like 2 places at once.
I'm like
Oh,
not seeing how to do that, unfortunately.
interesting. Okay.
It's just showing people on my screen. And at the top, there's just like the 2 little people and the chat icon. And then,
Interesting. Okay. I'm going to the roles and I am removing the steering committee members, at least a few of you. Brianna, I'm going to keep you as a co-organizer so you can bounce around. But Eliza, Maida, Ruth, I'm going to... Sarah, do you want to go into a breakout room?
Hey, I am driving. I'm almost home, but I can't like drive it myself. So I'm happy to, but I'll be on the road for a few more minutes. I know I didn't like choose a specific one, so if there's anyone that needs additional eyes, I'm just happy to go wherever.
Okay. Let's see. Let me think about that for a little bit more. But in the meantime, I'm going to assign these other folks to their rooms. So
Michelle, Sarah can come to room. I mean, there's only 2 of us in potentially in room 4. So that might be a good option.
room 3. Yeah, okay. Let's see. Yeah, this is so strange because I can't move any co-organizers, so I have to change the roles here. Okay, and Eliza, you're going into room 4 with Molly,
It said,
right?
yeah, but it's telling me to join room 1, so I'm not clicking on join yet.
Okay. Okay. Maybe someone tried to invite you. There, I'm putting you in room 4.
Okay, let's see fit.
And Ruth, you're going to room 2 now. Okay. All right, so room 1 has 3 people, room 2 has 3 people. Wait, is that right? Room 3 has 6 people in it. Oh, but I think that's because someone has an extra phone number in there. And then room 4 has a couple. So yeah, let's see. Just to give Molly a little more support, Eliza's in there with her now, but yeah, Sarah, if you don't mind, I'll go ahead and just put you into room 4 too. Or also.
Yeah, that works.
Okay. All right. Okay. Yeah, and Rachel, I'm seeing your chat message that for the breakout rooms to be recorded, we need to have at least one person in each room that pushes the record button. I Gosh, can I even get into, I thought that as a co-organizer, I could just like pop into the rooms, but I don't even know how to. You know what? I'm gonna try. I'm gonna try to get in there and we'll see how this goes. Hey, so I was able to join the different groups and get recordings started, but then I had to be on hold in all of those groups. So I don't know if that's going to affect the recording or not. Hopefully not, but I think what I just remembered is that the co-organizers have to join the rooms by like hitting the 3 dots and then joining. I didn't have to assign them. So anyway, it's a learning experience. I'm not super concerned about not having recordings for those conversations, but in the future it'll be nice to have. Brianna, did you have any trouble getting into the rooms and checking out those discussions?
Yeah, I'm actually hopping around now, and I can see your recording is still going. So I was trying to type it in while you were
Oh,
talking.
great. Okay.
But,
Yeah,
like
I
when
need to get
hopped
one
in, it
going in
says
room
like
4.
you are being recorded, and I was like, okay, cool. Because I
Okay.
just hopped from 2 to 3, and then I'm gonna go to 4, then I'm gonna start back at 1 again. Just kind of going in. Teresa's doing a great job.
Yeah.
In that room. Oh, in room 1. So she's driving. I'm letting her go. Letting her
Yeah,
drive.
yeah.
Just following suit. But yeah, everything's going great.
Awesome. Okay, I'm gonna start the recording in room 4 then.
Yep.
Here we go. All right, apparently I've reached a call limit and I can't join yet another room. So unfortunately, one of these is not gonna get recorded.
Okay.
Well, we made
Looks
it.
like we're in the room, but there's pause. I see pause
I think
signs over Ruth and Michelle.
Yeah, I think they're in the breakout room still.
Oh yeah, okay. Oh, that's what that means. I see it over Meta too. Okay. Looks like we'll just kind of chill then.
I guess so.
I did it.
You did it. Yeah.
Oh, that's
The
I'm glad you
team's
kicked us
master.
out. Perfect.
I don't know why anytime I try to go to the SharePoint, it just brings me to the SharePoint site, not like the documents.
Oh, really? Even on the links for the document?
Yeah, it's weird. I don't know why
Oh,
mine's doing that. Okay. And that was expanding remote access pathways through okay. So that makes sense. And I think this also even ties back to like the education campaign
yeah, that's
that
what
they're working
that's
on.
what Molly really emphasized that, and that's a really, really good point because a lot of this is gonna be encouraging agencies to develop their own policies because realistically, um, there's not a ton of restrictions federally or statewide, right? And so it's just really going to be working with agencies to develop their policies and procedures, and then providers would have to adhere to that.
I don't know, I'm like thinking of some some big ideas, but I don't know if they're actual ones that can actually do anything. So I mean, like they have to go through like licensing, right? And like what if we like required them to have like a plan for training and for providing services as part of like
Their
receiving?
BHA stuff.
Yeah.
I mean, that I think that, that's a good point. I think that there could be collaboration with DOH. And
Yeah,
if that's like
that's
a realistic thing to say, like, hey, as part of this, can they have a like, do you guys require a telemedicine policy? And if not, can you?
yeah.
Yeah, that's a good point.
Can I add that?
Ah, please.
um,
I mean, and they obviously can't force people to do telemedicine, but I think that they can put, there's potentially an option to say, like, they should all have a blurb regarding telemedicine. Like our agency does not offer it at this time, whatever, but if they do offer it, like it should, that's a really good idea. Especially because the research, like even post-pandemic, we don't have a lot of numbers, but we did see like, numbers increase, for access to services. And then of course with like outsourcing, like being able to get, a psychiatrist through a virtual platform when you couldn't get one through your behavioral health provider agency. You know what I mean? There's just
yeah.
a lot of there's been a huge increase of access and lowering kind of barriers. The biggest, I think, component is in rural areas, where there isn't Wi-Fi. I know some were talking about investing in like, phones with data service to be able to do that. So,
Mhm.
that kind of stuff.
Hi, team. Is room 4, did you guys finish early?
Oh yeah, we rocked it.
Yeah? That's
Yeah,
amazing.
I mean, yeah, we definitely.
she had to leave for a patient care issue, but I think we pretty much put a nice bow on the conversation.
Oh, wow.
Mhm.
That is awesome. Well done. Yeah, it sounds like as I've been kind of, hopping between the different breakout rooms, like the conversations are very engaged and they're getting a lot of work done. So this is it's kind of amazing, right? When you just make the groups a little bit smaller, how much more folks are willing to contribute, or just feel like what they say will move the needle. And so anyway, the breakout rooms are pretty awesome.
Agreed. Yeah, and I think it's like helpful to narrow down the topics, right? Because when we see like
Yeah.
all of them, it's like my brain's going there and there and there. But to have like one focus, I definitely think made it like easier to have a more robust conversation or focus.
Yeah. Yeah, for sure.
And we were talking all about telemedicine. You remember our pandemic days, Michelle?
I know.
Michelle
I
used to
was
help me
like,
write
oh, I'm glad
those.
this. I know. I was glad to see that recommendation kind of pop up. I was like, oh yeah,
Mhm.
there's a lot we can do with this, and I have so many saved resources.
Right?
Yeah. Um, let's see. Yeah, I'm gonna pull everyone back at like 10:25, but until then, I hope you're all just feeling free to work on other things in the meantime.
Sounds good.
Yeah. All right, team, I'm gonna start pulling them back in.
Yeah, and it should save.
Pop in and out a few times, so.
Yeah, it should
Okay.
save.
Okay, thank
Saves
you.
itself in
Oops.
SharePoint.
Hi, everybody. Sorry to yank you out of your rooms like that. I know those were some really good conversations happening. You know, I was able to eavesdrop a little bit with each of those, and looks like you got a tremendous amount of work done on those recommendations. So bravo to everyone in the breakout rooms. We've got just a few more minutes left in the meeting, and I just want to talk about what the next steps are going to be. So since those notes, those recommendations are all hosted on SharePoint, I'll be able to share those out, those links to the rest of the SUDISA work group members who are not able to be here at this meeting today, and the rest of you to take a look at what's been done on those recommendations, and provide additional comments in them. Because they are live documents, it's easier to collaborate together with those, right? But it's also harder to track different versions. So I will try to make it clear to everyone when we send out those links that any edits at this point should be made as comments or highlighted in a different color or something like that, tracked changes, so that we understand like where additions are coming from. And can discuss as a group about the final versions, which we will discuss at the next meeting, which is going to be August 12th. I do want to note that there's going to be a SUDISA work group update given to the Substance Use Recovery Services Advisory Committee, the SURSAC, at our next meeting with them on August 5th. So if anyone from the SUDISA work group wants to attend the SURSAC meeting and listen to the updates about this work group and potentially even answer questions about conversations that we've been having, then that it would be actually really wonderful to have some work group members present at that meeting. Not mandatory at all. Those meetings are recorded, so if you just want to watch it later, you will be able to do that also. But if anybody wants the link to join those meetings, I'm happy to provide that, and we'll provide that actually in a follow-up email. So there's that, and then we are going to need to have recommendations polished up enough soon to share with the various associations that also have an interest and will be impacted by these recommendations and the changes that may ensue from them. And Brianna, I was thinking, I don't mean to put you on the spot, but in terms of stakeholder input, given that our next meeting with the SUDISA work group members is August 12th, when will you need input from associations that should be taken into consideration for drafting the recommendations? We can also talk about this after the meeting, but I don't know if you had a day in mind already.
I think we can kind of follow suit to the other timeline that we made for the safe
supply. Yeah, like August 23rd, right? That's what I was thinking. Okay.
Yeah, we can follow the same. It should still provide me enough time. I think we have good enough information and I can just plop in. I kind of see where this is going now, like just listening to everybody. So I have a good idea now of where this is going to take me. And so I'll, yeah, if they want to provide it by August 23rd, I'd appreciate it.
Great. Okay. Yeah. So between this meeting and the one on August 12th, we will be inviting more input from work group members to solidify the recommendations that you've all done so much work on today. And then hopefully have those polished up enough to share with associations after the August 12th meeting. And if they can provide their input to us by August 23rd, we'll be in very good shape. So, per the last time we talked about this, we have been reaching out to those different associations, asking them how they want to provide input. So we will continue to do that and have those plans in place for when the recommendations are ready. All right, we're past time, so thank you all for being here. And again, thank you so much for all of your hard work. Great work today, and we will see you on August 12th. Have a great day.